Can you still see the slides?
Yes.
Yes.
It's not in
Yes.
presentation mode though.
Okay. All right. So this is our agenda for today. So we'll be doing a little introduction and history of the Aging Coalition, and that'll be with me, Amanda Evans. It'll be about 10 minutes. And then we're going to be talking about growing a village, and that'll be with Annette Kelly. And then supporting a village, Diana Silvey. And then the overview of villages with Joel Shapira. And then we'll have a question and answer time, and then we'll talk about what's next after this meeting. Some action items. Alrighty. So what is a village? Hopefully that question will be answered throughout the meeting today. We'll have 3 speakers, like I said, talk about those things. Hopefully you had time to watch the 2-minute video that was in the email that I sent with this meeting invitation. It's from a California village that has an amazing village program. So I think it just shows what a village can be. So the main focus is supporting the desire for older adults to age in their community. And that can look like a lot of different things. It can look like transportation to doctor's appointments. It can look like help to getting into a grocery store. It can look like collaboration between different agencies. It could be a 501c3. It could also look like a bunch of volunteers that are just helping each other and building relationships together in a community. So why did we decide to have an interest meeting today? So we're still in the exploratory phase of developing a village. We have a few really awesome people that are part of our subcommittee right now, but we're looking to grow. So if you are this person, or if you know somebody, please invite them to join us. Like I said, we're still in this beginning stage, so we have time to add people to our team. So we're looking for passionate people, excited partners that serve this population, and people that have a background maybe in grant writing, event coordinating, volunteers, and more. And I really liked the term that I stole from somebody else, an army of engagers. So this could be you. So I know you might have forgotten what I look like in person. So the Aging Coalition was started in December of 2018. And so I'm on the left there. And like I said, my name's Amanda Evans. And then Abby is on the right. And we started with a grant that we got from the Trust for America's Health and the John Hartford Foundation. And we started and we weren't really sure where to go. So we approached different people in the community that were big players in the aging game. And we decided to start a coalition because that's what public health people do. So in April of 2019, we started our first Aging Coalition meeting. And since then, in September of 2019, we had our first Village to Village subcommittee meeting. So Barbara, somebody you'll meet later, came to us and said, this is a really awesome idea. And so it's kind of grown from there. In December of 2019, we did a needs assessment, and I'll show you more in the next slide about that. And then today, you're part of our history, our first Village to Village interest meeting. So we're really excited about that. So we did this needs assessment. We surveyed 360 65 and older people that are in our Lee County area. I just wanted to show this slide because it shows that we really got a good selection in our community. We got people from every zip code in Lee County. So I think that's really important to show just before we get into the next couple slides about it. This survey was passed out through libraries, aging organizations, the Harry Chapin Food Bank, and FGCU nursing students, and other people in our Aging Coalition. So this is the living situation of a lot of Lee County residents. As you can see, mostly living with a spouse or living alone. Some are living with family, and some are living with a partner. So that living alone number is pretty high. And so it's just something to point out. Social isolation can be a really big factor. And that's one of the reasons we're having this meeting, is to try to combat that. So it's just important to understand the housing situation here. So these are some reasons that Lee County residents want to age in place. A lot of them like it here. Yes.
The slides aren't moving on the show. So I'm still on the needs assessment. There we go. Thank you.
Yep. Maybe just had to reload it there. Thank you for that. No, I appreciate it. So a lot of people like to live here. A lot of people, feel that they receive the support and the care that they need. They may have family in the area. It's too much work to move. These are just some reasons that people like living here. So 77% of the population that we surveyed plans on aging in place. And I think that's a really important number to throw out there, because that's a lot of what the village is trying to do, is to allow people to make that decision. If they want to age in place, they have the resources to do so. Another thing that's really important is to understand why people don't want to age in place, or feel that they can't. And so a lot of people said health issues and the support needed. They might not be a full-time resident. They might need to downsize, things like that. So it's important to know that for when we talk about gaps in our community and the perceived gaps that people have. So as a coalition, we took all that data and we voted on 3 major areas in Lee County that we think that need improvement. So these are the 3: social isolation, transportation, and then health and wellness. So after voting on those, we chose to go with social isolation. We felt that that impacted the other things, and this was actually pre-COVID. So really interesting to hear that that's, still a huge problem right now. So a lot of our efforts have shifted to go towards the village-to-village movement. And so it's just something that's really important to us as a coalition right now. And so that's why today's meeting is so important. So I want to introduce you, before we get into our speakers, to our village-to-village subcommittee members. So I'm going to let each of them introduce themselves, and they can do it in order of how their names are up on this slide. So I will let Barbara go first.
Hi, I'm Barbara Scherer, and my husband and I retired to Fort Myers 5 years ago. And I first learned about the Village to Village network about 10 years ago. I was very intrigued by it. It's a very creative idea. And I just look forward to working with you in exploring starting a village in Fort Myers and Lee County. Thank you.
Hi, I'm Patty Duncan. I also have been in Florida for full time for over 10 years. I am ungraciously aging in place. And when Barbara mentioned this village concept, I thought it could be so important for so many. So I'm glad to be a part of the launching.
Hi, folks. My name is James Brooks. I live here in Fort Myers. I'm actually a neighbor of Barbara's, and Barbara is the one who got me involved. So I'm officially a community member interested in seeing this come here to our community. In my day job, I actually work for AARP in our national office and focus on community engagement. And so in my work life, I've actually worked with some villages around the country, but the reason that I'm on this this group is because I'm really interested in seeing how this could come right here. Amy, I don't think we can hear you.
I'm sorry, I'm technically challenged, so that's right off the bat. But I'm Amy Costanza. I'm an outpatient nurse navigator with Lee Health, and I work with Medicare patients in the community. And I'm really excited to see how this could impact our seniors in Lee County.
And hello, I'm Bernice Kurtavage. I'm with Career Source Southwest Florida, and I am aging gracefully, I hope, in Southwest Florida as well. I'm also quite intrigued on how we can serve all of Lee County and partner as agencies to serve those who age at home.
Michael, you wanted me to check with you.
Hi, my name is Kim Gade. I am with Lee Health. I'm the Community Benefit Outreach Manager. I work out in the community with our underserved, as well as our veterans and our men and women that are currently deployed.
Hi, good afternoon. I'm Aubrey Bowers. I'm the medical director for the Central North Florida region for Humana, and I cover the Gulf Coast from Sarasota down to Collier. And I live here in the community of Lee County in Cape Coral, originally from Pennsylvania. And based on what I observe in our community and also what I do for Humana, I see a great need for this service and to help our seniors.
Hi, I'm Abigail Reedesser. I work at the Florida Department of Health here in Lee County. I'm the other co-lead of our Aging Coalition, so I was the person on the right side of the picture that Amanda had earlier.
Yep. And Amanda Evans, I already introduced myself, but I also work for the Florida Department of Health in Lee County. I'm the other left side of the picture, Aging Coalition co-lead. All right. So we have some awesome speakers with us today. We're hoping to go through and learn about different aspects of what a village can be. So Annette Kelly will be our first speaker, and she's actually from a village in Florida, so I think that's really great. Diana works with her, and so she's going to give us a really interesting talk about, supporting a village. And then Joel is going to give us more of that national village to village network kind of viewpoint, and how, he's reimagining the villages. So Annette Kelly is our first one. So her introduction is, she's one of the founders for the Neighbors Network. As a nurse practitioner and a professor of nursing and a woman of a certain age, Annette is well aware of the many challenges associated with growing older. Less talked about, but more important, are the many life-giving opportunities available to us. The village movement provides examples and models to live active lives connected to our communities. So I'm going to pass the baton to her.
Wow, thank you so much. Am I coming through okay? Can you hear me? Yeah.
Yes.
Okay. I'd like to start just by saying that we started just like you're starting with an interest group. And it's so cool because being interested is really the main ingredient for moving this forward. Interests come in a variety of forms and a variety of people and for a variety of reasons. In our case, we heard about the village concept at an Administration on Aging national conference, and it was really intriguing. It was Beacon Hill Village, the founders that were speaking to us, and that was in 2010. So it's, oh my goodness, 11 years ago. Isn't that amazing? So we came home, a couple of us, and gathered our colleagues in the community and other people who we knew would be interested. And you can move that slide forward if you like, because I'm looking at the timeline. Thank you. Our meetings were enjoyable, and most of those people are still actively engaged 11 years later. I am happy, I'm not going to read this slide to you because you can read, but happy to provide population numbers and early reports to anyone who requests those. We did document everything we were doing, and that was really very valuable as we moved forward. Beacon Hill Village published a how-to manual, and there are probably others that have been published since then, and that was very helpful to us because I think understanding the role of another organization and sort of seeing yourself in that way is a great model for moving forward. We encouraged academic involvement in our community and did some needs assessments and population studies that would help us understand, just who the population was and what their interests might be. We didn't want to think that just because we were a group that was aging and thought this was exciting, that was what everyone would think. I think some things to mention here, obviously the funding was very, very valuable, but even more than that, the relationship with our funder, who you'll hear from next, actually mirrored for us how to be in relationship in the community. It's so important for that to happen. We're not competing with any other services, even though sometimes it feels that way. And that's really something important to get through. We had a part-time executive director during our formation stage, and we moved from that to a paid part-time volunteer coordinator and a finance administrator, moved away from the executive director model and took on those leadership roles as a board of directors. And that was a decision we made so that we could stretch our funds and so that we didn't have to charge a huge membership fee, which we felt was going to be better for our community. We made some changes along this timeline. You can see we started with a certain geographic area and we added a little bit more because it made neighborhood sense to do that. We had an interesting concept shared with us by someone from another a very well-developed village, the concept of leaky borders. You set your goals around an area, and then you meet someone that's just across the street. What do you do? So flexibility is a really important quality as we formed ourselves and as we talked about what the future would look like. The next slide, please. Some of our early decisions and some of our early behaviors, having group meetings with open dialogue, keeping up with the research on aging in community, reading the literature and including data and trends, understanding what was happening for people, how individuals were seeing their aging journey, not just us, but everyone. Connecting with like-minded groups. Some of our partners were a nonprofit adult day service provider, a lifelong learning organization, the local libraries, a ride services nonprofit. Everyone was willing and freely sharing their experience and how they saw the community developing. We had lots of open discussion. We studied examples of villages that were not just in formation but flourishing. It was important to us to look at villages that were like our community. And there are several different models of villages, and we found that it was not that helpful to really dig into the details of a village that was very different in their formation. As an example, there's a village in the western part of the country that has close to 700 members, and everybody communicates electronically. It's really a large homeowners association type of membership. Everyone is a member. It's a little bit different than making a decision to join, so there are real differences in how villages get formed, which is wonderful for our country and our aging population, but it's not always helpful to look at that and say, oh, they have so many members, what are we doing wrong? That's not the point. We are, in Neighbors Network, a traditional Beacon Hill Village model, and you know, that's kind of the model that we've followed. One of the cool things we did was invited Gail Cohn, who was the executive director and founder of Capitol Hill Village in Washington, D.C., to visit and meet with our big group. I myself visited her village because I had a granddaughter in college in that area, so I had a chance to visit their village a couple of times while we were forming all of this. I mean, I spent time in the Capitol Hill Village office just sitting in the corner, listening to the phone calls, absorbing the people, the dialogue, getting the atmosphere, all of that. It was so helpful. So as you travel, make sure you look at the map and see, where's a village near here? Can I stop in for a couple of hours, go to a meeting, go to a social activity, that sort of thing. Another early decision is to decide what you're not. We left healthcare referrals to a partner who had the means to manage thorough vetting. And we did not have that means as we started. And we left that kind of service to our members up to this partner. I can share more about that for anybody who would like to know about it. Next slide. We decided not to offer transportation in the beginning because we had a partner that was a nonprofit ride service. And after a year, a little more than a year, we needed to add ride services because the partnership changed. And so we were able to make a decision to move forward and add that service. So don't be afraid to reconsider. You know, you start out with a menu, so to speak, and then you look at how is it going and what's happening, and what are the requests that you're getting, and what are people saying when you ask for feedback? What do members think about it? What are volunteers saying? We kept in dialogue so that we would be able to use real information to make decisions. We thought partnering would be a better way to do it, but things evolved differently. We also added 2 zip codes to our zip code list during that time, and that was because the neighborhood really made sense to have that part of our community included. The next slide, please. The next slide, please. Thank you. I think I'd like to emphasize, in terms of our funder, the Winter Park Health Foundation, I like the play on words there, a foundational relationship. I would like to stress, though, the importance of the relationship. It is a relationship. Funding support is more, way more than a transaction. Just like a village is not a transaction. It's sort of important. It's very important to be thinking about what you believe about how people work together, and how members and volunteers within the village have a stake in the outcome. So true is the relationship with the funder. And I've listed the ways that the foundation, the Winter Park Health Foundation, provided more than funding, way more than funding. Although I would say that the funding was critical and valued and welcome, all of those things. And as a community partner, we're still in relationship. So that's my timer that just went off. So I'm gonna just go quickly. The next slide. Very early, the next slide, please. That very early, it's important to include older adults in the planning. We were a group of older adults, and we weren't just service professionals, although several of us were. We had the concept of training and having 5 or 6 ambassadors who would be the individuals that would visit anyone who was interested in becoming a member, to really get the gist of what the person's view of all this was, and what ways membership would be important to them. As you're developing your village, remind yourself of the mission frequently, because it can really stretch and grow and become more than you intend. Our mission is to stay active, engaged, and connected as we grow older. Volunteers are the key to success for this. The next slide, please. One of the important skills or qualities, I guess, as you launch your village is to enjoy it. Even the bumps. And when you're not sure, be honest. I think that can be a very valuable thing. I'm not sure how to answer that. What do you think? How should it be? And I think the most common challenge that we have met is when talking to someone about Neighbors Network. This is a very frequent dialogue. The answer or the comment will be, "Oh, it's wonderful. I love it, but I don't need anything. I'm not ready yet." There's a whole parcel of people who are not ready yet, and yet we are all ready to be in relationship and to be safe, active, engaged in our community. Instead of talking about needs, then we talked about what are the wants. What do people want as they grow older? What do you want it to be like? What would help it be that way? How can you contribute to it becoming that way? Those sorts of things. The next slide, please. And I added this one because I wanted you to see that in January 2020, before the infamous year of 2020, we were on the verge of booming, of growing, of flourishing. And here we are in February now of 2021 with fewer members and fewer volunteers. However, we are on the verge of growing better. We learned a lot. We learned that social relationships are much more important than we realized, and that being trustworthy and true to what our mission is can really impress and build those relationships in the community. And I think we're stronger than ever. In January 2022, we expect to have welcomed new members, trained more volunteers, etc. So thank you all. It was my pleasure to be here today.
Thank you so much for that, Annette. We really appreciate it. I love hearing the success of other villages in our area.
Yeah, it's wonderful.
It is. All right, our next speaker is Diana Silvey. She works for the Winter Park Health Foundation, where she serves as Vice President of Programming for the Center of Health and Wellbeing. Before assuming that role, she directed the foundation's older adult grant-making portfolio for nearly a decade. It was in that capacity that she came to embrace the village concept and facilitated funding Neighbors Network within the foundation's geographic footprint. So I will give it over to her now.
Great. Well, good afternoon, everyone. So as Annette has said, it's a pleasure to be with you all. And if Amanda, if you could advance to the next slide, or Abby, I'm not sure which of you wonderful women are doing that for us. This question was posed, what is the relationship between the foundation and Neighbors Network? And I have indicated there a few of those roles that we have played. Certainly Annette has touched on that very kindly and very nicely. Again, we have certainly been a funder for the village, and both in the form of a planning grant and in a startup grant. And that was primarily to, bring a best practice like this to our community. So we really saw that as an investment worthwhile. We've been a community supporter with periodic in-kind services. And by that, I mean things like, offering our boardroom up for, strategic planning meetings, offering refreshments, snacks, food for periodic meetings in our space. So just little things like that, even sometimes printing things. If, there was a tight budget, we've been able to do small things like that that are often not a strain on the foundation at all, but can be very meaningful to, to partners such as our grantees. I have been a board member there for a number of years and even a volunteer, which I enjoyed greatly before I got too crazy busy to continue. And some of the things that I dearly enjoyed were things I could do remotely because time was somewhat precious, but a good example is like sending birthday cards to members. So that was something that was an easy thing to do that I truly enjoyed, and I could almost imagine the people's joy on their faces at having received some little gesture like that. Our biggest contributions again, outside and apart from the financial investment was, I think, the credibility that we brought to the project. So, to have a local funder step up and say, we believe in this idea, we believe in this group of people. So that reputation, I believe, was very helpful. Expertise, Annette touched on that, somewhat in an earlier slide. Certainly, as a board member, I would like to think I made a few contributions in that area, but we also have, great connections, and others provided some expertise as well. And an ongoing commitment that, I'm proud to say exists to this day. Word of mouth, we talk it up every chance we get. We still very much believe in the concept, and of course, checking in periodically to see how things are going. So some people ask, why did you fund this village concept? And I think in order to understand that a little bit, we need to know a little bit about our organization, and just the fact that we've been around since 1994. And we have had a long-standing commitment to fund older adult programming. So very much believers in the need not to forsake that population, but to think about it as a incredible period that can be, vital and vibrant, and really a great relationship between older adults and the community. Another thing that drew us to the network and funding it is the appeal of the innovative model that would be new to our area. So again, we were in the practice of searching out different models that were in place elsewhere in the nation, and really trying to understand, is that something that we could bring to our community? And this certainly piqued our interest. And it really made sense to us. So that leads into the second one, which was, it seemed to be a real win-win concept. So we knew people wanted to stay in their homes. So it really fulfilled their desire to age in place while keeping them in the community, which was, to everybody's benefit, from the tax rolls to, faith communities, grocery stores, you name it. It was just a win-win. And so again, why not try it? Why not invest in it? We are a little bit different in the sense of a very local funder, that we fund primarily 3 communities in Central Florida here: Winter Park, Maitland, and Eatonville. I think they have a total square mile footprint, because they are contiguous, of about 17 miles maybe. So we're small in the sense of, where we really direct our resources. So this made sense in terms of the geography. When we look at the county that we sit in within the state, it's Orange County, and it's about 1,000 square miles. So it is huge. And so we're always looking for programs and great ideas that directly impact those 3 communities, but have the potential to be scalable. So that was also a big draw for us. Our foundation is all about prevention and wellness, and really has been in that space before it was popular, so to speak. So this was really a great fit for us to invest in the health and wellness of older adults, and really preventing them from moving on to living situations that perhaps were not appropriate for them because of their health, didn't really warrant it, but sometimes you get looped into those unfortunate circumstances. So again, this really was a good fit for what we believe in. We know the demographics of our community, which, continue to be a large aging population. I think now that can be said for almost every community. And then, of course, you saw the dynamic leadership of Annette Kelly, who we believe very greatly in, and has an excellent reputation in our community for getting things done. So when she came with this idea, it certainly seemed worth considering. The other thing I was asked about, because I do think, and I find this unfortunate, but I do think there's sometimes a fear about approaching foundations, and they can come off as uncaring, and that's certainly, I don't think anybody wants to do that, or bureaucratic, and how do we get to who we need to talk to. So I think, Annette touched on it, it's all about the relationship, and just sitting down with, a program director from the get-go and saying, I want to know a little bit more about your funding priorities. I have this idea, what can we talk about this? Is there any interest? So just, don't do like us to cold call, but I would suggest that you reach out and get to know your local funders. You know, they have a mission to fulfill too, and that's to work with partners to get things done. So it's important that those connections be made early, if at all possible. Some of the mistakes we see is, you know, chasing the dollars. I understand how that happens. I'm not really being critical about that. I'm just being very honest about there is mission creep as you chase the dollars. So as Annette said, you know, revisit your mission often. I also see, and I think we're all guilty of this, overly ambitious objectives. So, you know, you're full of energy in life and you're ready to take on this challenge and oh my gosh, we're going to get X, Y, and Z done. And you know what? It's never as easy as it looks on paper, right? So be realistic if you can in what you think you can accomplish. I have a saying, it's always better to, you know, under promise and over deliver, right, than the other way around. We also see, unfortunately, you know, if there's $100,000 available through a grant opportunity, everybody needs $100,000. I mean, it's not necessarily true. So, you know, I think just do your homework, ask for what you need, don't ask for more, don't ask for less, but, you know, don't just go for the top dollar because it's available. I think that's something that's too often pursued. We also see, unfortunately, things that, you know, don't really match up. So if you don't do your homework when you provide some of your budget estimates, most of the time the people that are reviewing the grants have the experience to see through that. So if you're talking about rent an office space for somewhere, you had better do a little homework about what those square foot rates are, okay, and really think about that stuff. If you're talking about bringing somebody on board, you know, as an executive director, what are you going to have to pay them, and what's realistic based on, you know, a salary survey that you might be able to access from your area. We see flow of proposal, you know, sometimes things, and by that I mean like things just don't fit together really. So, you know, you're looking at one portion, which is the action plan, and you want to accomplish, you know, a set of 5 things, and then when I get to the budget part, there's not that connection, you know, like, well, how are they going to do that based on what they're asking for? So it's kind of just making sure all those parts really fit together. Flow is probably not a good idea, not a good description there, because most of the time grantors tell you what the flow is, but you get my point, I think. Also, not following directions, you know, that's the easiest thing in the world to do. So please don't get yourself disqualified for any type of a formal grant opportunity because you're not using the right font size or you're attaching things that won't be read or whatever. And then finally, the last thing we see is just failing to account for reality. And so I think that is, to Annette's point, being flexible. You know, not everything you do is going to work out according to plan. But you have to think, I think, a little bit on the front end, if at all possible. And in particular, now I'm talking about, you know, this situation where this was a 3-year grant. A lot can happen in 3 years. Look what's happened to us in the last year, right? So, you know, you have to kind of have some contingencies in there for, you know, when things don't work out according to plan, and be honest about that when they don't work out according to plan. Again, it goes back to that relationship of, you know, gosh, we thought this was happening. Look at what we learned. And now we need to pivot and, you know, move more a little bit in this particular unforeseen direction. But again, that's all about a constant conversation. So my advice to your group, which by the way, I think is amazing that you have the kind of people assembled that you do already. I really give you great kudos for that. You know, consider asking for a planning grant before you jump in for, you know, full-fledged with both feet. That's going to teach you a lot. Learn from other villages. So everything you can that, and again, Annette touched on this, from villages that are working in areas that are like yours, as much as you can match up those, you know, demographics, geography, et cetera. Line up as much support as you can with community partners. Again, this is what I just talked about. You guys are already doing a great job of that with some of the leaders that you've amassed and assembled, and keep it up. The more you can get the word out there and explain the concept, the better. And then finally, just, you know, really make a case for why the existing models are not sufficient to address the future needs. We know the numbers of people that are growing older every day just continue to escalate, and will do so for a number of years. And we're just really not equipped with a lot of good options to meet that growing demand. So with that, I will turn it back to Amanda.
Thank you, Diana. That was awesome. It's so nice to hear from not only people that are involved in, the grassroots part of the foundation or the villages, but then also to hear from people part of a foundation that's supporting local villages. So hopefully we get some great local partners like similar to you in our area. So thank you for that. So our next speaker is Joel Shapira. And so he helps tech-enabled services companies with business growth acceleration. A member of the Village to Village Network Board for the past 6 years, Joel now leads Reimagining Villages, which is an initiative that's national, focusing on developing new programs and strategic partnerships to expand the possibilities of helping neighbors to help neighbors helping neighbors. I'm going to hand it over to Joel now.
Thanks, Amanda. And I just want to be sure we're going to stop at the top of the hour. I want to make sure there's time for questions, right?
Yeah. If we could keep it to 10 minutes or so, that'd be great.
We're gonna make it less because I'm gonna improvise a little bit because the best thing, you guys have already heard the most valuable content from Diana and Annette, who have really lived this, and I just want to give a context, and I'll take a couple minutes. Well, I've got a couple slides that we can talk through, but I think it's more important that people have a chance to ask questions. So let's go to the next slide. What I wanted to do is demonstrate that what you all are doing in Lee County is building off a social experiment that really started about 20 years ago in Boston. You heard Annette talk about Beacon Hill. And it was really about people coming together to support one another and offer ways to get a little bit of help. And that model, that original concept, has evolved over this 20-year period, but it continues to be a social experiment. There is no one way to do a village. And so part of what the excitement is of mobilizing a group of people and a group of organizations together is to figure out what is the right thing for your particular community. This is not a franchise. This is not a templated project. This is really a grassroots co-created initiative that happens right on the street, feet on the street kind of thing. And I wanted to highlight that because that's really at the heart of what the village concept is all about. People helping one another and supporting one another. Go ahead, Amanda. So I just wanted to, this is probably more complicated than it needs to be, and I think we could spend some more time on it. But what I just want to point out here is Village is about supporting older adults, but they're also about community development. They're about bringing disparate groups together. They're about being the connective tissue among existing organizations that are already providing services in the community and helping those organizations grow and amplify their efforts so that we're reaching a lot more people and having more impact. And the whole goal is, how do you help people live longer, better? And this is, again, part of the whole social experiment piece. Needless to say, this last year has proven worldwide, not to mention here in the US, that we all have a lot more work to do at a community level. Next slide, please, Amanda. So what I like to talk about here, again, in that sort of 20-year history, is we've had different waves of villages emerge. There were about 50 or so villages in the first 8 years. Then through some good marketing, we had more and more people raising their hands saying we want to start villages in our community, and that led to the formation of a national organization called the Village to Village Network, which essentially is charged with helping communities get villages started. And that really played out over that 4-year period and continues to this day. And then over the last 7 or so years, we've had new models emerging. You heard Annette talk about the village out west that has 700 members. There are different ways to do a village. And the most important thing is that it works for your community and continues to innovate along the way. And that's really what I want to highlight here. Over the last couple of years, even before COVID, there really was much more thought and effort and experimentation into what else could be possible for villages both at a local level and at a national level. I've been fortunate to be involved for about 9 years. I was on the board of a village here in outside of Chicago, and I should point out, I wish I was in Southern Florida today. I'm in the cold of Chicago as I join you all. But I was on the board of a village here, and then I was involved in some other villages getting started in Chicago and then some other communities. And over the last 6 years, I've been on the national board. And my belief is we are really just getting started. This is a 20-year process that we have a foundation, but we only have a couple hundred villages in our communities today. And we, again, have seen over the last year how much opportunity there is to reach older adults and their family members in a much better, more impactful way. Next slide, please. So the key thing is looking at what else could we be? How can we reach more people? How can we be more inclusive? How can we reach different socioeconomic and racial groups within our communities? How can we bring younger generations in and have it be more of a mixed experience, right? And I believe, and others believe, that part of that is through different kinds of partnerships with technology companies, with healthcare organizations, with financial services, transportation. And if we work together in more of an ecosystem, we really raise opportunities for everybody involved at all ages to connect and contribute in new and exciting ways. Again, that's what I believe is what's so special about the villages. No, perfect, Amanda, thank you. So part of what, as we went through the quarantine last year, some work that had started even prior to that really amplified the need and illustrated even more what else we could be doing if we operated more collectively. It's already started in Florida. It's happening in other parts of the country where different communities are starting to look at how could they raise all ships, if you will, by operating collectively? How could they partner with different organizations? How could they collect data and report differently? With this idea of how do we reach more people and truly become a thriving national and potentially international movement, reaching as many people as possible. And that's really what I'm interested in, why I'm so excited about what's happening on the west coast of Florida. I believe we really have an opportunity to reinvent, reimagine, and develop new models of operating that will reach more and more people. And that in some ways, you all don't have a script to follow. That's both the good news and the bad news. But we're going to learn about what you're doing. We're going to help you connect with other organizations that are also doing it at similar stages. And then we're going to share the information across the country. And that's really what Reimagining the Villages movement is all about. And really why I'm here today, and will continue to help along with others as this process continues to evolve. What's the next slide? I think I can pretty much sum up from there. Do I even have another slide? See, perfect segue right into questions and answers. And I think I was less than my 10 minutes even. So thank you all. It really is a pleasure to be here. And I'm happy to have follow-up conversations offline as well. And I can share my email and phone number too. So thank you all very much for having me participate. Barbara, thank you in particular for welcoming me into this process.
Thank you very much. We really appreciate it.
Thank you so much, Joel. And to all of our speakers, we really appreciate your time and efforts today. It was great to hear from local speakers as well as at that national level. So I appreciate your time. Before I turn off the PowerPoint, I just wanted to invite people. I know one of the questions that we got in the registration is how are we not duplicating services here? How are we avoiding that duplication? So one of our next steps is going to be having a SWOT analysis meeting. And if you're part of this group and you registered, then we have your email. If not, you can email me and I can get you an invitation to this. So it'll be exactly a month from now at 2 p.m. And so we're going to go over specifics to Lee County and analyze what our strengths, weaknesses, opportunities, and threats are. And you're welcome to join this meeting and invite others to join, even if you weren't part of what is going on today. So I'm going to turn off the slides and we can get into the questions. Abby, do you want to see if there's any questions in the chat?
Yeah, like they were saying, if you have any questions, feel free to put them in the chat, or we could even, I guess, raise hands if you wanted to just speak